In the news tonight, stand too close and get arrested. Concerns over frontliners' fatigue. And export market on a volatile trend.
From the studios of FBC Suva, Edwin Nana.
Bulawanaka, Fiji. The Permanent Secretary for Health, Dr. James Fong's daily briefing will begin shortly, and we will bring you live coverage as soon as it begins. Our journalist, Josiah Nanunga, is at the Health Ministry. Josiah, any movement there?
Edwin, we are standing by here at the Ministry of Health and Medical Services headquarters in Turek Suva, where PS Dr. James Fong will be delivering COVID-19 updates. All media have gathered together as we await for the announcement. Earlier today, the Health Ministry confirmed our third COVID-19 death case, a 53-year-old man who was admitted at the Lutaka Hospital since the 16th of last month and was transferred to the intensive care unit yesterday before he passed on at around 6:35 p.m. yesterday. I can also confirm, Edwin, that the Prime Minister Borengem Bainimarama has been part of the daily briefing with the top brass of the Ministry of Health as well as the top brass of other government departments just to ensure that thorough, accurate and effective COVID-19 updates are disseminated to the general public. To you, FBC News viewers, stay tuned as we will be bringing you the Permanent Secretary, the PS address with the press conference that is due to commence soon. Edwin.
Naka Josiah. The Fiji police force can now make arrests of people and business owners failing to follow physical distancing rules in Suva. Acting Commissioner of Police Risyate Tundravu confirmed this to FBC News this afternoon following a meeting with the Suva City Council. Apenisa Wangai Randovu with the details.
Any business in a public space that does not have markings for physical distancing will be answerable to the law.
Identification of mark that needs to be done there. If that is not complied with, and then we can effect arrest on that. That's empowered under the legal notice.
Tundravu says this is the same for people who will not practice the measure. Suva City Council Chairman Isikeli Tigundondo says the efforts had been made to create utmost awareness in the communities, and enforcement shall now be greatly strengthened. The Suva Retailers Association says their members have been told about their social responsibilities during this period.
Yesterday they were out in the field and discussing this with the supermarkets and the pharmacies that are open, that please they have to follow the rules as well and enforce it.
The council will be working closely with the Fiji police force to ensure that the same measure are stringently applied at the supermarket and the Suva bus station. Apenisong Garandobu, FBC News.
Senior management of relevant agencies are keeping an eye out for frontline workers suffering fatigue. The Health Ministry, police and military have been operating on a 24-hour basis since the first case was confirmed on 18th April. The mental and physical strain on frontline workers is not being ignored. These Fijians have been working long hours with almost no downtime for the last 18 days.
Fatigue is normal, but for the security forces particularly, we plan for worst case scenarios, and relief systems are always in place.
Managers down at the ground level have identified staff that need support, whatever support they may be in terms of counseling, in terms of rest, and the mentoring that needs to happen.
Senior management have been advised to ensure that teams on the ground pace themselves and supervisors keep an eye out for anyone who may be struggling. All staff must also have necessary protective gear.
Providing them with the necessary support as well. And that goes for rest as well as food and protective clothing and equipment. These are all the things that will contribute to the welfare of those that are in the front line.
The time spent in quarantine or isolation for a particular group of staff is also the ability to make actually rest and recuperate.
With doctors and soldiers testing positive for COVID-19, the government is mindful of the threats frontliners face, fighting an unseen enemy. The trade and export market has been on a volatile trend lately, with some markets seeing an increase while others recorded major declines. Investment Fiji says there is a demand in international markets for specific products, with kava and wood chips among the most sought-out commodity. Koroi Tandulala reports.
While cover exports have increased by $11 million, with the USA being our major buyer, some other markets have recorded major losses.
But there's also some markets that have decreased. So in terms of export performance for Fiji, US has decreased by about 38 million, mostly driven by mineral water. But in US, there are certain products that have increased, like kava and also turmeric, that have seen a lot of increase.
Investment Fiji says the latest figures highlight that global trade and services are projected to decrease by 9%.
And in terms of other markets that have decreased is Japan. Japan has also decreased by about 17 million due to wood chips. So these are kind of the performance at the moment if you look at Fiji.
Put less pressure on our foreign exchange and less pressure on our import. So if this slowness does that, it's kind of blessing.
The recent figure released by the Fiji Bureau of Statistics indicate domestic trade dropped by 3%, attributed to the impact of the COVID-19 pandemic. Investment Fiji is conducting an e-trade expo in a bid to explore new trade markets and attract international investors. Koroi Tandulala, FBC News.
Coming up, no restriction on grocery assistance. And ministry looks at bigger sites for vaccination. Welcome back. Fijians who are eligible for the $90 grocery assistance from the government will be able to buy any item of their choice. People can apply for assistance by sending a text message to 161. This number can be used by both Vodafone and Digicel customers. Jeshulal reports Fijians are urged to send all necessary details via SMS for faster turnaround time.
Random verifications will be carried out to ensure there is no abuse of the $90 assistance program.
Only one individual from a household gets the assistance. Those that will try to abuse the system may face legal consequences.
Chirigounder says people can buy any grocery from the cash provided.
Providing this cash generally targeted for families to purchase groceries, but we are giving them the freedom to choose items that they can purchase.
Those eligible can use either the Vodafone network or Digicel with no fees and charges by service providers.
It's a very matured system. It's working very well.
Follow the registration process, so without even having to visit any of the stores, you could register yourself for the service.
The assistance for people living in the Nandi area from the Momi Junction to Lomo will be processed first, followed by Lotoka, and others will follow suit. All these applications will be verified with the Fiji National Provident Fund, as well as customer needs from Vodafone and Digicel to identify these locations. Jeshulal, FBC News.
Empower Pacific has noted a drastic increase in the number of Fijians seeking psychological support over the last few days. Most of them are battling different forms of psychological issues or vilification in the Greater Nandi and Lautoka containment areas. Details with Josiah Nanunga.
A few counsellors are stationed inside the Lautoka hospital to support health staff and patients who are now under lockdown.
We are trying to support our staff. Telecounseling services have been activated since last year, and we have normalized this as a means of service provision.
Empower Pacific is working closely with relevant authorities in a bid to tackle various other social issues and render psychological or emotional support, as these services are greatly needed in these trying times.
To inquire about the current lockdown situation, also request for food rations and medication. Also, we are advocating for gender-based violence and child protection-related issues.
Give us a call. We'll try to help wherever we can. We'll do our best, and particularly with our partners like the police officers and other people.
Fijians who are currently facing various challenges can seek support services by calling 293-7141 or 7765626. Chosayananunga, FBC News.
The Ministry of Health is looking at bigger vaccination sites to better control the crowd following the local transmission of coronavirus. The ministry is strict with safety measures at vaccination venues, and people are urged to practice social distancing and wear masks and at all times. Kritika Kumar reports.
Fijians are being urged to register online before visiting the vaccination site to reduce crowding.
We learned a lot from the Vodafone Arena, and replicating the same thing in the other sites has been really good because it helps us demarcate where individuals can go.
The Ministry of Health has noted a high uptake of the COVID-19 jabs.
That vaccination has been rolling out, and it's good to see the acceptance in the community now. It's been there before, and I know a lot of people had been calling also for vaccine.
Permanent Secretary for Health Dr. James Fong says no Fijian is fully vaccinated and everyone must practice health protection measures until full immunity of the eligible population is achieved.
The day we're able to roll out these vaccines everywhere in Fiji into the arms of every eligible Fijian is the day that lockdowns like the ones we have endured here in Suva become all but unnecessary.
The ministry with the first 2 batches had already vaccinated 10% of the targeted population. Kritika Kumar, FBC News.
Minister for Economy A.S. Syed Qayyum has called out Sodelpa MP Linda Tambuya for making idiotic claims about how he brought the COVID virus into Fiji and how it was then subsequently spread into the wider community by the Fijian military. Tambuya made her fantastic claims in an email which she sent to numerous individuals and politicians a few days ago. Lina Rees reports.
According to Sodelpa MP Linda Tambuya, the Attorney General brought the Indian variant COVID virus into Fiji on his private jet, and subsequently the Prime Minister's beloved military then spread it in the wider community. This email was sent to numerous people, including the NFP and Labour Party leaders and former and present Sodelpa leaders.
It's what a nincompoop would do.
Tambuya wouldn't answer any calls from FBC News but responded to text messages saying she stood by her comments in what she claims was a private email.
Obviously, Tambuya has got no health experience, nor does she have the qualifications or the acumen, one would argue, in respect of making those kind of medical calls. You have the Dr. Fongs of this world, you have the Dr. Alicia Sokans of this world, and the whole team out there that actually make those assessments, not some person who's trying to personalize matters and make a political mileage out of it.
The commander RFMF says Tambuya's comments are a waste of time. FBC News has also reached out to the Prime Minister for comments. The Attorney General says a bit of decency, decorum, finesse and class is required of Linda Tambuya. Lina Rees, FBC News.
Welcome back. The Trans-Tasman bubble between Australia and New Zealand has partially popped. New Zealand has paused flights from New South Wales for 48 hours as concern grows over a new case in Sydney with missing links. US President Joe Biden says he will support easing patent rules on COVID-19 vaccines after intense internal debate and strong pushback from American drug makers. This will potentially expand the global supply and narrow the vaccination gap between rich and poor nations. There's been a COVID scare at the G7 summit in London, and the entire Indian delegation is now isolating after 2 members tested positive for the virus. It's the first 3-day foreign ministers meeting in the UK since the pandemic started. An oversight board, while upholding Facebook's suspension of former US President Donald Trump, says the social media giant is wrong to make the suspension indefinite. And just a quick update, we expect tonight's daily briefing on COVID-19 to get underway later this hour, and we will cross live to the Ministry of Health as soon as Permanent Secretary for Health, Dr. James Fong, is ready to deliver his address. But for now, we join Whitney with business.
Thanks, Edwin. Coming up, tourism-driven economies need vaccine. And Lambasa man optimistic despite economic downturn. Stay with us. Tourism-driven economies cannot wait for the next 1 year to get its population vaccinated, says Minister for Economy Syed Keum. Speaking at the ADB Governor's virtual meeting today, Syed Keum highlighted it will be a tragedy only 40% of the population is vaccinated as opposed to 65%. He adds they will have to wait for the remainder of the population to be vaccinated within a year to make travelling to Fiji attractive. Syed Keum urged ADB to use its convening power to ensure Fiji and other small countries get access to vaccines. New Zealand has pledged 500,000 doses of vaccines for the third quarter of this year.
We need to put in place the building blocks so we can actually take advantage when the border is fully open. We cannot be sort of reacting to a situation when the border is open. We need to pre-position ourselves, and that is critically important, and that requires accessibility to financing, it requires accessibility to be able for the technical aspects of opening up the economy.
Fiji has commended the Asian Development Bank for its timely support with a policy-based financing of $407.3 million. Minister for Economy Syed Keum made the comments during the Governor's business session of the 54th annual meeting of the ADB. Syed Keum says through such partnerships, Fiji will be able to quickly assess an additional $305.5 million financing. He adds Fiji will continue working with the ADB on future policy-based financing packages to support our national budget and continue with the national reforms.
In this area, very, very critical. We've been very grateful to our lending partners, including the World Bank, the Asian Development Bank, Asian Infrastructure Investment Bank, and the Japan International Cooperation Agency specifically, for the invaluable funding support during these challenging times. We also thank our bilateral partners who scaled up direct budget support funding during these tough times.
$35,000 worth of grocery vouchers has been donated for frontliners, including police, military and medical staff. Shop and Save Supermarket has provided the vouchers to assist those who've been working at containment borders, quarantine facilities and screening teams around Fiji. The assistance has been welcomed as a moral boost for the thousands protecting Fiji from COVID-19.
We are in a very challenging time, and we are all in this together, and we are indeed grateful that the private sector, particularly Shop and Save Supermarket, can offer this great assistance.
Donations such as these are very helpful in being able to support our frontline staff. What has been great to see is the way that civil servants right across Fiji have been able to come together, just as we do with any other disasters, and work hand in hand.
Here the local exchange rates are set early this morning. The Fiji dollar was pegged higher against the Chinese yuan, US greenback, PNG kina, euro and the Japanese yen. However, it declined versus our two major trading partners, the Aussie and Kiwi dollars. Commodities market was mixed. Oil rose a few dollars at $65 per barrel. Gold dropped, closing at $1,787 per ounce, and silver closed down at $26.51 per ounce. We now join Sanifa from HFC Bank to give us the latest U.S. economic data from the money markets.
Thank you, Whitney, and good evening. In the money market, the U.S. dollar drifted below a two-week high, consolidating ahead of a key U.S. jobs report that may provide clues on when the Federal Reserve will dial back monetary stimulus. The U.S. dollar has rebounded from a one-month low over the past week, supported by U.S. economic data that has largely reinforced the case for a rapid economic recovery. So far, Fed Chair Jerome Powell has argued that the labor market is far short of where it needs to be to start talking of tapering asset purchases. The central bank has said it will not raise its benchmark rate through 2023. Meanwhile, tonight, Bank of England will announce its latest economic forecast for the British economy. It is also expected to keep its benchmark interest rate and its bond buying program unchanged when they announce their monetary policy summary. Although many economists forecast that Britain is now set to grow more than 7% this year, traders will be looking out for any such confirmations by the central bank itself. That's all for now from HFC Bank, Vinaka.
At a time when the future of businesses is unknown due to the COVID-19 pandemic, a family has opened up a new restaurant in Lambasa. The owner of the Northern Cuisine restaurant says he is ready to defy all odds. Eleanor Turangaivu has more.
Opening up a business of his own has always been a dream for 38-year-old Avikash Prasad. This dream became a reality today.
My hobby, but own business is good.
Prakash was born in Riketi and only reached year 4 in school. Growing up, he took on odd jobs like fishing, cane cutting, unloading trucks and being a sales boy to meet the family needs.
That time is very poor family, no background there.
The hardship he went through challenged Prasad to save up in order to open his own business to help alleviate their struggles.
Lambasa people friendly, no plenty people here. Then restaurant is good.
His wife Ranjana Wati says they decided on a restaurant after they realized the needs of customers have changed during these challenging times.
Because I know this time people not running for the clothes. They're running for the foods like this.
The couple believes that through hard work and sacrifice, anyone can achieve their goals, even if it may seem far-fetched due to your circumstances. Eleanor Turangaivu, FBC News.
That is the latest from my end, but coming up after the break, woman defies all odds to continue assisting family. Stay with us.
Welcome back. Numerous challenges and hardships have not stopped 60-year-old Miriani Lilieta, who's been selling freshwater prawns to support her family. Lilieta is a regular at the Nosori market and has been since 1981, using her income for over 40 years to run her household. Kelly Vadala reports.
This vulnerable lass braves the cold at dusk to catch freshwater prawns. I've been marketing here for over 20 years and selling these prawns have been the source of livelihood for my family and I. After every market day, I go back to Nodo in Rewa where I stay and catch more prawns at night.
Miriani Lilieta is currently the sole breadwinner of her family.
I have been able to do hire purchase through my microfinance program. I have bought appliances and stuff at home. I was able to put my children through school and they come and help me sometimes.
The grandmother says the market is her second home where she has inspired others.
When I started, there wasn't a lot of women, but now majority of the vendors are women because we want to earn instead of staying at home.
The goal for Miriani is to open up a prawn shop and further expand her business towards the export market. Kelly Vadala, FBC News.
Attorney General Said Kayum says for small island countries, climate finance means adaptation finance. Said Kayum says while climate finance has not been an easy task, COVID-19 has made it more difficult and urgent. Said Kayum adds, without adequate source of finance, small countries like Fiji face more exposure to risk in these unpredictable times. He says the COP26 presidency should finalize Article 6 of the Paris Agreement so that there is a stable source of revenue for the Adaptation Fund under the Sustainable Development Mechanisms. He adds the Adaptation Fund cannot continue to depend on ad hoc handouts.
Estimates for adaptation financing are expected to range from USD 140 billion to 300 billion per annum by 2030 and could rise to between USD 280 billion to 500 billion per annum by 2050. Fiji alone would require about 4.6 billion US dollars by 2030 to adequately ingrain adaptation and resilience into our development agenda.
The trade and export market has not been spared by the impact of COVID-19, and tonight we speak with Investment Fiji's Trade and Investment Manager to tell us more about it.
Thank you, Mr. Chetty. What sort of response have you been able to gauge from the Fiji New Caledonia E-Trade Expo?
And out of that, we have received a number of interest into cocoa products, moringa products, sugar, noni juice, hand sanitizers, kava, and other wood products. So this is kind of the interest has been to date.
And what are the main commodities or services that are most commonly sought by international market?
Specifically, the 3 expos that we have run, we have interest on health products, noni products, moringa, designer wear, kava, garments, food and beverage, and sugar, pastries, wood products. So this has been mostly the interest has been primary products.
I understand the trade has been significantly impacted by COVID-19. Now, what are some of the goods that were able to maintain its upward trend despite the pandemic?
We've seen interest in kava, wood chips. There is also interest in turmeric, noodles, sweet biscuits, frozen tuna, sugar, and other manufactured products.
And lastly, what other countries are you planning to explore and get on board to join this E-Trade Expo?
Moving forward, we're looking at launching next week, Tuesday. On 11th is Fiji-China Trade Expo. Then we're looking at Japan. This will all be translated into the respective languages. And also later on looking at US and other countries.
And the Permanent Secretary for Health, Dr. James Fong, has now arrived for his daily COVID-19 briefing. We take you live to the Ministry of Health headquarters.
Today, we've got a slight change in the way that we're doing our update. I'll be giving an update. Usually, as expected, Dr. Alicia will talk about the laboratory results and some of the lab data, important data. Dr. Chemesa will also add some more operational detail to some of the updates that I have. And then finally, I have Dr. Ali from WHO, who will give us a short WHO perspective on the current initiatives that we are currently doing. As we announced earlier today in a press statement, the individual admitted to Lotoko Hospital Intensive Care Unit yesterday from a severe illness due to COVID-19 has sadly passed away. As I covered in last night's press conference, the patient was transferred to ICU yesterday afternoon after his condition began deteriorating. It was at this time that he was swabbed and tested positive for the virus. Unfortunately, despite the best efforts of the ICU team, he passed away a few hours later with a time of death of 6:35 p.m. We are devastated by this loss. For the teams of doctors and nurses I lead, one fatality is far too many. We actually learned of this gentleman's passing just before our announcement last night. But we chose to delay making the official announcement until after we could properly inform his family members. No family should ever learn about the death of a loved one on the news or on social media if that can be avoided. And we stand by the decision to allow them a window of privacy before the passing of their loved one was announced to the nation. This may technically be Fiji's third fatality due to COVID-19, but it's our first death from a locally transmitted case of the virus. So our sorrow this time is matched by an extreme urgency to stop the spread of COVID-19 in our communities and to prevent our more vulnerable Fijians from succumbing to this terrible virus. We suspect this patient was the source point of transmission to the two doctors in Lotoko Hospital who were previously announced as COVID positive. But we still do not know how he contracted the virus. I read some comments last night and today, some confused and some were angry about why this gentleman did not consent to be tested for COVID-19 until quite sadly it was too late. I can't speak to his decision. But I know I speak for the staff of Lotoko Hospital when I say this. This is not the time for blame. As we have seen, this virus can attack anyone. Pointing fingers is pointless. We urge the public to show concern and sympathy for all people who become infected. We also urge the public, once again, to agree to be tested if there is even a small chance you may have been exposed to the virus, to cooperate fully with the contact tracing teams, and to observe the practices that keep us all safe. It could easily be a matter of life or death. This is a devastating virus, and as we have said, it is very unforgiving. Even the smallest lapse or mistake can be fatal. After another 1,723 tests, we have confirmed 4 new cases of COVID-19. The first is another border quarantine case who traveled with a border quarantine case announced earlier. Dr. Sahukan will share the details of that case later. 3 are local cases. One is a 47-year-old nurse at the Rawanga Health Center. She was swabbed after she reported a slight cough. After her positive result registered today, we immediately closed the Rawanga Health Center to the public. A contact tracing investigation has been launched. All relevant personnel and parents and patients are being quarantined. Her household contacts have also been swabbed. Her 51-year-old husband was also tested positive for COVID-19. He is also a focus of our contact tracing investigation. We only identified these 2 cases late today, in fact, sometime after 2 o'clock. And we do not have any clear link to the transmission of either case at the moment. Our other case is a 25-year-old nurse working in Lotoko Hospital. This nurse was sequestered within the hospital last night, along with the rest of the hospital's personnel and patients. Since her positive test results, she has since been entered into isolation. Investigations are ongoing as to how she might have caught the virus. Our testing has ruled out a breach in the Lotoko Hospital isolation ward after all the staff who are manning the COVID-19 ward returned a negative COVID-19 test result. This is a reassuring affirmation of the operational protocols of our COVID isolation ward, which must be maintained as the most secure facility in the country. Unfortunately, that's where the good news ends, because this indicates that the community is the most likely source of the Lotoko Hospital outbreak. In the early phase of our containment strategy, we hope to break the chains of transmission quickly by tracing and testing primary and secondary contacts of existing cases. We have always screened carefully for symptomatic cases among the community as well. However, this surge in cases of unknown origin demands that we develop much more stronger mechanisms of community surveillance. As our testing capacity increases, we are going to be even more judicious in our testing of all Fijians with COVID-like symptoms, regardless of their connection to existing patients. But the thing about community surveillance is that it requires the community. It requires that all of us are fully invested in the containment of the virus. Screening clinics can be opened, but it takes the initiative of an ill person to come forward for us to find them. Mobile screening teams can be dispatched, but my team work far better and quicker when people are honest with them and the public is cooperative. So please, let's make community surveillance more than just a ministry's priority. It has to be the people's priority. It has to be prioritized society-wide. Following this worrying spate of cases among our healthcare workers, we are also taking urgent steps to prevent more of our health facilities becoming source points of new outbreaks. Our long-standing protocol has been to screen all incoming patients for COVID-19 symptoms and test if necessary at admission. This will be strengthened. We also be heavily restricting visiting hours at all hospitals and health centers in Fiji to limit mixing between patients, medical personnel, and the general public. This was not an easy decision for the ministry. We only considered it given the serious threat this virus poses to our people and to our ability to offer other forms of life-saving care. With Lautoka Hospital now serving as a full-time COVID care facility, we need every hospital and health center in the country open and accessible for other critical medical treatments. This morning I finished a video conference with the team who was securely contained within the Lautoka Hospital Command Center. We will be activating FIMET, the Fiji Emergency Medical Assistance Team. And as our Honorable Prime Minister announced today, we have dispatched the government medical carrier vessel, the MV Vevueti, to support our healthcare management strategy within the Lautoka containment area. To cater for non-COVID patients, we are setting up a 150 non-COVID field hospital in Lautoka. We have a plan to have this open in 48 hours to handle patients with illness that can be treated on a 21-day, over the 21-day timeline. Extending from the field hospital will be clear patient flow pathways that allow patients to be moved securely to other hospitals and healthcare facilities if necessary. We also manage staffing within the field hospital in response to patient demand. The field hospital will enforce strict COVID screening protocols and security to ensure that it is a COVID-free facility, while Lautoka Hospital remains exclusively a COVID care facility. To ensure there are no lapses in healthcare services for those looking to visit public hospitals, I have been talking to a number of our private general practitioners in the Nandi, Lautoka and Ba area to open the doors of their clinics to those Fijians who normally cannot afford to visit a private practitioner. Under the soon-to-be finalized arrangements, patients who normally go to hospitals and health centers can access non-COVID treatment or consultations at private clinics in Nandi, Lautoka and Ba. Government will directly pay the private practitioner for the treatment and the consultations provided for such people. Tomorrow we'll be announcing the names of the private doctors who have stepped up in solidarity with the ministry to ensure that our people can access the non-COVID care they require. I urge others I haven't spoken to call me. This is an opportunity for us to bring public and private sector together at a time of urgent need for our people. Again, government will be footing the bill for the services that you private doctors provide to those Fijians in need. Most of you have my mobile number. Call me and let's get you on board. Contingency plans have been developed for a range of scenarios, including the need to expand capacity in the event of additional community cases in and outside of Lautoka, a severe weather event, or a COVID link in the field hospital. This is the first major operation of FIMET in response to a national disaster. Our teams are ready to show the nation what they can do. Lautoka and Suva are not the only areas of the country that require vigilance. We now have too many cases of possible community transmission to say, with confidence, that the virus is limited to our containment area. Earlier, we announced that non-essential businesses outside of the containment area may open. This is simply no longer worth the risk. These non-essential businesses should close. Nationwide, supermarkets, shops, banks, pharmacies, and other essential industries, as previously announced, are the only business that should open. The cost of this outbreak are already unacceptably high, and I cannot stress enough how important early preventative action is to stopping the cost from rising any further. Early diagnosis of the virus can increase survivability. Early society-wide prevention measures can decrease widespread transmission. Wash your hands often, wear a mask in public, install Care Fiji, and keep it running every time you leave the home, and also maintain physical distancing at all times. The police has announced today they will be enforcing physical distance in public places and businesses. If you see a crowd, don't add to the problem. Stay away. Better yet, don't leave your home at all. Stay home. My staff in Lautoka Hospital don't have the privilege at this moment, so let's honor their sacrifice by staying within the safety of our homes as much as possible. COVID-19 has never posed a graver risk to the Fijian lives than it is today. If our ICUs become stressed with high numbers of COVID positive patients, we will be hard pressed, like other countries with high rates of infection, to fully treat people who need critical care. And it will be too late to prevent a great deal of human suffering. We still have a chance to stop that from happening. I have detailed the steps the ministry is taking to make our services as COVID safe as possible. I ask that households, communities, organizations and businesses all think just as seriously about the steps that they can take as well. The health guidance we publish is the baseline for the actions and behavior that we expect from businesses and the public. If you see an opportunity to go above and beyond our guidance to keep yourself, your workplace, and your household members safe, please take it. You can save a life. And together, as that commitment carries across the country, all of us can spare Fiji from further heartbreak of losing more patients to this virus. Thank you.
So as just announced by the Permanent Secretary, we have 4 new cases to report. I will talk about the border quarantine case that he mentioned. So this is the 4th case. He's a border quarantine case, and this is a 22-year-old Tongan national who was repatriating to Tonga from Guyana, and he arrived in Nandi on April the 22nd on flight FJ1410 from Auckland. This was the last inbound commercial passenger flight before inbound international passenger travel was halted. He is also the traveling partner of a previously announced border quarantine case, and that is case 115. So it was expected that he would test positive for the virus eventually. So with the new cases, the 4 new cases announced today, there are now 42 active cases in isolation, 9 are border quarantine cases, 29 are locally transmitted cases, and 4 are currently under investigation to determine their source of transmission. The cases under investigation are the 2nd male from Ra, case 116, the 25-year-old doctor at Lautoka Hospital, case 120, the 25-year-old nurse from Lautoka Hospital, who was announced today, case 126, and the 47-year-old nurse from Rewanga Health Center, also announced today, case 127. The source of transmission for the recently deceased patient, case 125, is also still under investigation. So now Fiji has had 129 cases in total since our first case was announced last year on March the 19th. And we've had 84 recoveries and now 3 deaths. A total of 60,054 COVID-19 lab tests have been conducted since we started testing early last year. And our daily average of testing is now at 1,437 tests per day. And yesterday, 1,723 tests were conducted. Our weekly average of testing is at 5,995 tests per week. Our overall test positivity, so out of all of the tests we've conducted since last year, and the number of positives we've had is 0.2%. And our 7-day average daily test positivity, so looking at the last 7 days and the amount of positive cases we've had over the last 7 days and comparing it to our testing, is 0.1%. Thank you.
Good evening. So as stated by the Permanent Secretary, in the case of Lautoka Hospital now operates as a COVID hospital, which means that only cases that are positive for COVID will be admitted and treated at Lautoka Hospital. Kamikamida Health Center, Punjus Health Center, and VCC Health Center remains operational. Kamikamida Health Center will operate for 24 hours a day. Punja's Health Center ceases operation at 8 p.m. So there'll be Kamkamida Health Center will be the only health center that will be operating throughout the night. And again, for pregnant mothers, VCC Health Center operates 24 hours a day, providing for your care and for the delivery of babies. And again, as I said yesterday, for all patients that are presenting to the health facilities, expect to be swabbed for COVID-19, and please agree when our health officials approach you. The FIMET hospital will be set up at the old government supplies. For people of Latoko will know, in Natokoanga beside the LTA office and Nandovu Park. So it will play the role that Lautoka Hospital plays in secondary and tertiary hospital care. It will start operating by tomorrow afternoon, and once fully operational will link with the other health facilities around Lautoka, as well as linking to Nandi and the Mbaha hospitals. The FIMET also has units that currently operate in the Western Division, in Singatoka and Rakiraki, and this morning a contingent of 7 doctors and 12 nurses from the Northern Division joined their Western Health colleagues, supporting them in their role. Rewanga Health Center is temporarily closed. So the health, the screening, COVID screening that currently is held at their clinic will now be done by the nearby rental board facility. But patients who need treatment for their sicknesses will need to present to Samambula Health Center, the Sai Sanjivan Health Center at Super Point, or at the Valley Levu Health Center for their illnesses. Our community screening, as stated by PS, continues. The stationary clinics, the mobile community screening, and the targeted screening, and we're very happy with the current coverage that we have achieved. In the last 24 hours, our stationary clinic screened 5,179 Fijians and undertook swabbing for 642 individuals, for a cumulative total of 40,102 screened and 6,904 swabbed. Our mobile screening continues in the Western and the Central Division as well, and in the last 24 hours screened 11,812 individuals and swabbed 399 individuals, for a cumulative total of 255,360 screened and 7,677 swabbed. We continue to operate our community isolation facilities. I've stated earlier, there's 13 facilities. We currently use 4. Of the 13, 11 are schools, 1 town council facility, and 1 forestry ministry facility. We currently have 48 individuals in 4 of our community isolation facilities. And again, as I've stated before, these communities are out of bounds to the general public. Our quarantine facilities continue providing, accommodating our positive contacts, our contacts for positive cases, as well as our quarantine repat individuals, and currently our numbers of repat have dropped to 267, and it will continue to drop as repats complete their requirements for quarantine, 14 days of quarantine, as well as the necessary tests. To complete our messages remain the same. Our contact tracers are following up on all transmission tracks and leads that can identify other cases of COVID-19. But we are asking for everyone's support, and you can support this team by agreeing to be interviewed And if you're interviewed, please tell the truth. Don't hide anything from the interviewers. Agree to be swabbed, and in the process, download and activate the Care Fiji app, which will be of great help to the team. Navale.
Bula, everyone. Good evening. I know I speak on behalf of all my colleagues at WHO about how deeply saddened we are about the report of this death today. And our thoughts are with the family of the deceased. It does say that we can and must do everything possible to keep this virus at bay and stamp it out of Fiji. There are some tough choices we need to make right now. And as WHO, with all our partners, we stand behind the Ministry of Health, the government of Fiji, and all partners who are working tirelessly to control this virus. The first death from local transmission announced today reminds us of the real grave impact that this virus can have on individuals, families, communities, and the country at large. What that means for us, and the challenge to continue to provide essential health services and other services in the country, is that we really, really must address this very serious public health emergency. It's a very serious issue, and the response that has been mounted by the government, with support from all government departments and everyone working closely together with the Ministry of Health, has been a very robust and appropriate response. We are all going in the right direction to try and stamp this virus out and stop the spread any further in Fiji. But the quickest way out of this is not just what the government does, it is also what we do as a community, as individuals, as families. We all need to play our part. And that very simple message remains. Stay home, help to stop the virus moving with you or anyone else. If you must go out, please wear the mask that you've bought, that you've designed, that you've created yourself. Don't forget it. Take it along with you. Wear it. Keep your distance from others. No mass gathering. And do remember to install your Fiji Care app and keep it running. And more importantly, I want to pause and say thank you to our colleagues who've been doing contact tracing. They need your cooperation and support. Dr. Jemesa has said it, Dr. Alicia has said it, Dr. Fong has said it. I'll repeat it. When they do come knocking on your door, please cooperate with them. And when you are asked to come out for vaccination, do remember to bring your family members, especially the ones who are most at risk of severe disease, the elderly, those with underlying conditions. Register now so that we have your name, so that when you're called, you can come out and you get your vaccination. Our colleagues from the Ministry of Health and all our government departments, including soldiers and policemen, have been working tirelessly all night, all day. It's a 24-hour operation. And since April 18th, when this started, more than 10,000 tests have been done, over 300,000 people screened. They can only do this because they've been working all around the clock. I know Dr. Fong and the team barely sleep. You can do your part to support this work. Please stay home. Don't move. Don't let the virus move with you. Thank you very much.
Thank you very much, members of the media. We open the questions now. Next question is
Shanil, Fiji Village. Dr. Fong, you had spoken about the Lautoka Hospital, where 400 people are in a containment zone for an indefinite period, and one nurse has also tested positive. So are all measures in place to make sure there is no breakout of cases within the Lautoka Hospital?
Yes, we have the protocols in place in Lautoka to sequestrate or to separate the positives from the negatives. Apart from that, there is a running testing of everybody that goes back and forth, back and forth. So we expect them that over the period of time that they'll be there, each individual should be tested at least 4 or 5 times to make sure that they are, a normal quarantine period, you just test once and then twice, and that's it. But this time we're going to be actually testing them a number of times, back and forth. And as you get more positives, you put them out into the isolation place until we can get a true segregation between the positives and the negatives. And then we are sure that the positives and the negatives are truly separate and the negatives are truly negative, then we're going to be able to say, okay, now we are ready to get the place back up on its feet again.
Dr. Fong, just to follow up on that, we have had that unfortunate incident at the Lautoka Hospital and now the Rewanga Health Center as well. What are the heightened measures that you've put in place to ensure we don't have a similar situation at the CWM hospital?
CWM is what all the measures we're taking at the moment, in a way, it's solely based around protecting CWM. Everything we're doing, right now, the female people going out to Lautoka, whatever the job they're doing right now is to protect CWM. And to protect Lambasa is not that bad because it's across the water, and we have, definitely we're not going to let people go across from Vitilevu to Honolulu. Anybody found illegally going across will be asked to go back. But yes, I mean, you make a point that we are creating layers and layers of protection against CWM. In fact, as we speak, there's a group of people who are going to scope out Fulton College and see what's our ability to convert that into some health facility that we can work with. So we are trying to create more and more capability within the community to keep CWM more safe. We've got a lot of urgent services in CWM. You will find that even before this, it was difficult to go and visit anybody in CWM. Now it's almost impossible. There's going to be very more strict measures taken with regard to staff and the way that they come in, they get screened when they start work and when as they finish during the course of their duty while they're on roster. So a lot of other measures are actually going to take place. Once we get a bit more testing capability, we may have to escalate our testing regimen to actually deal with that, to deal with that protocol of protecting all the CWM and the other hospitals.
Jose Nununga from FBC News. Dr. Fong, I understand that you've highlighted some restrictions in regards to does the ministry has any plans in place for the next few hours to institute a total lockdown, just like what it did over the last weekend, particularly in the Greater Suva area, as I believe the couple were not in quarantine before being confirmed, and the risk is there to the thousands of Fijians, especially along the Grantham Road. And secondly, about the lockdown at Wainitaroa in Cunningham, supposed to be lifted on the 15th. Any update on that?
I've mentioned before, like for the couple from Rewanga, we just found out the test results around 2-3 o'clock this afternoon. We're rounding up all the contacts that they have. We also know that very soon is curfew. So we do have some opportunity to ensure that we get some containment plan and we swab them and we get more information leading up until 4 o'clock in the morning. Once we reach that point in time, and then we will start to work out, well, what else we need to do. Okay, personally, I would like to sit back again, look at the data, and see whether a lockdown will work. See, the point about the lockdown is that it's no point just locking down for the sake of locking down. I have to lock down an area where I can say this is an area that I can, the the lockdown has to serve a purpose where I can actually find people and pull them in. If during a lockdown period I can't find people, there's no point. It's just like when we did with the Lyndhurst, with the garment factories. When we knew the address and the phone number of everybody, then we said, okay, now we can do a proper lockdown. We are also very aware of the side effects of lockdown. We are aware of the social problems that are associated with lockdown. So we don't take that lightly. So if we're going to lockdown, we must make sure that we can actually find people. And that means we have to have all the data with us. And then they say, right, now we can lock down. So what I'm getting at is that please, the public need to understand the lockdown is not something you just throw in and then you think about what to do. You think about what you're going to do in the lockdown, then you put the lockdown. Wainitaro settlement, we are, as far as I can understand, the tests have been done.
Yes, so for the Wainitaro settlement, the exit tests have been done at Fiji CDC. What's just left now is for the central division team to match that against the names that they have for the contacts. So all the tests so far have been negative, but we just have to make sure that everybody on that list has been tested. So that's with the divisional team. And an announcement should be made within the next day or two. Thank you.
Dr. Fong, Litya Dava from the Fiji Times. So you mentioned about the strict measures that you have in place for staff. If you could just walk us through regarding the current protocol that you have in place in terms of ensuring that staff in hospitals are also protected.
We, again, the screening protocols we are all aware of, how people are screened before they actually come on duty. We also have all our PPEs that we have to maintain the supply of, which of course is something that's going to escalate. When I say we're going to have to do more, that means we'll have to increase the amount of utilization of various PPEs. Of clear importance will be this one, and the hand sanitizers. We need good amounts of hand sanitizers around so that we can make sure that at least the person can keep themselves clean at all times and prevent themselves from acquiring any virus. Apart from that is also the screening of the public as they come into the place and the screening of patients as they get admitted. All those will ensure that, as far as is humanly possible, we can make sure that the hospital actually stays COVID-free. Beyond that, these are the measures that have been taken upon internationally. We are confident that they have been shown to work in other countries. And all it requires is that we apply those measures in the same way that has been applied in other countries.
Just my last one. Dr. Elisha, you mentioned yesterday about the recoveries. There are 9. Maybe if you could just state if they are border quarantine cases or local cases.
So when I report the cases that we have left, active cases in isolation, that's when I break it down. So we've got 42 cases in isolation, 9 are border quarantine, 29 are locally transmitted, and 4 are under investigation. We're not going to release to you about who exactly left quarantine and whether they were border cases or locally transmitted cases. And it's been explained before, because if we start saying that case number 115 or 1 has been released, it's very easy for certain organizations to look back and say, okay, this person came from this community, so they're going back now. We don't want that to happen. We don't want the community to be waiting for them and ready to victimize them as they're coming back. As I've mentioned so many times before, it is not important for us to identify these patients to the public. That is actually will work against all of the measures that we're trying to put in place now. If people are scared to come forward and get tested because they're afraid of how they're going to be treated by the public, no one's going to come forward. And we're going to have a massive outbreak and that will go out of control and it will affect everybody. So we do our best to try and protect the identities of our patients, but at the same time, give the information to the public that you do need. Thank you.
No, ma'am. My question is, if you could just be general. I'm not going for the case numbers. If you could just general, if they're quarantine cases or if they're local cases. That's what I'm after, and not the case numbers.
Okay.
Because I'm sure people will be familiar with the case numbers. I'm after that, whether they're
Okay, so it's a mix of both. It's a mix of both border quarantine and locally transmitted cases.
Did it involve the couple from India? Are they still
Oh,
quarantined?
exactly. That's exactly what I just said. What you're doing right there, you've identified patients.
No, ma'am, I'm not.
Yes, you are. You said that you are not going to identify patient by case numbers. You did worse than that. So please, I'm imploring you, please don't victimize the patients. Thank you.
Thank you. Livia Movona from Radio New Zealand. And my question is directed at Dr. Fong, Permanent Secretary. I'm interested in the government machinery that's been mobilized to respond to the situation in Lautoka, noting that you've mobilized personnel from the north and equipment from the Central Eastern Division this afternoon, and noting that you're working with the WHO and thereby then connecting with the donors. What I'm interested in is, in the future, in the very near future, should this escalate, as per what you alluded to yesterday, what sort of mechanism have you put in place? Have you made requests to the heads of governments of our usual partners indicating the need to join in your efforts should this escalate, as you've alluded to? I guess what the short question is, what plans have you got in place if the Fiji's public health system can't handle an escalation?
I might just give you a short answer, and I'll ask our WHO colleague to also step in. Essentially, what you have right now is an all-of-government effort. We've got trade and transport with MV moving across. They have got the tourism sector will be supplying another boat to accommodate the people to sleep in while they are operating MV. You have got the military and the police force helping to set up all our FEMA tents, all our screening protocols. There are various other ministries involved, from NDMO, the commissioners, all those government agencies who are involved in gathering data. They are doing the important task of pulling together data and ensuring that we got data that can govern or drive the response as is appropriate. Okay. A lot of that initiative is done in consultation with our colleagues from WHO, especially when it comes to data collection. I'll let Dr. Ali also comment on that.
Thank you, PS. The support to Fiji didn't start today with this outbreak. Since last year at the beginning of the pandemic, WHO with other UN agencies, including UNICEF and other UN bodies present in Fiji, with development partners, we've come together in a joint incident management team that you would have heard of before, and that is still in existence and continuing. We have a partners pillar within that group that brings together our colleagues from Australia, DFAT, from MFAT, from New Zealand. We've got funding support from the EU, from UK, and other donors who have been supporting the response and the preparedness effort for the Pacific and Fiji as well. So over the last few weeks that this has started, we've come together again to look at the needs in Fiji, to look at areas where we need additional support beyond the gaps that have been identified and how to respond. The fortunate thing is that the preparedness that we've started since last year has put us in a rather advantageous position to respond to this incident now. As I said earlier on, we hope to contain this. We're doing everything possible to contain this and that it wouldn't escalate. But of course, we don't live just on optimism. And therefore, we're getting ready to make sure that all the support that Fiji needs, which Fiji is actually doing quite a lot of good work within the government apparatus itself to escalate the support that is available, will be supported by us and donors and all the other development partners who are currently in Fiji.
So I guess, Dr. Ali, the question I was asking was, as you said, you're not going to rest on optimism. If it's a worst-case scenario situation, what is your plan? What is the government's plan when you run out of personnel to rotate from outside of the Western Medical Subdivision? What is your plan if you continue to have more healthcare workers get infected by this virus? That's what I'm asking.
I would let Dr. Fong say something, but I think the plan of response to the pandemic actually is based on scenarios and escalatory pattern. So I'm sure Dr. Fong can give you some details around that.
Please.
Actually, all of us can give you details around that. Right from even before I came in my role as to head the IMT in the 2nd of February. Before that, we had a response and preparedness plan that had all the necessary details of what would happen as you escalate through each scenario. Trying to detail out all these plans would be quite a difficult discussion, because it does require a number of setting up of a number of pillars that will be gradually activated as we escalate. And each of these functional pillars, they will all help us, not only help government, but they will also help our partners to help us. Okay. At a granular detail, as I mentioned to you, before this we had this thing called FIMET. We have practiced FIMET exercises. We have gone out during our cyclone Anna, and what was the one before that? Herald. We started from Herald, Anna, and the Yasi. Yes, Yasa. We used all that as our, we actually solidified a lot of our protocols around that for the FIMET. We reorganized the whole of the health system to have greater outreach capacity. This was in preparation for the possibility of this particular scenario. Knowing that this scenario can outbreak, we need to have the ability to reach out to people rather than have people to come into our facilities. And the other thing is that this FIMET group, it's called the Fiji Emergency Response Team, but it's part of a bigger organization. You got the Australian one, you got the New Zealand one, and the Fiji FIMET the FIMET one is the only one that exists among the Pacific Islands. It was an idea that was brought up by our minister more than 3 years ago, and it has eventuated to be purposed for this particular outbreak. So I can say that even before, when I retired and I came back and got re-engaged, even during my retirement, this plan has been going on, a response plan that involves quite a lot of partners. And I would say that we will have to unveil this plan as we escalate.
Dr. Fong, given that you have yet to identify the source of infection for some of the community transmissions, is it possible that this source of the infection would have stemmed from sources other than the quarantine breach? Are you...
Yeah, I mean, I can only discuss what I know. If not for the quarantine breach, then the only other breaches we can see is if somebody came into the country unknown. You know, I can't think of any other way for it to happen. Unless somebody came unknowns to everybody, they walked into the country and haven't been picked up. But I'm fairly sure that our immigration system is quite robust to prevent it. So we do know that it stemmed from around the quarantine area. And that's about all I can say. It's not something that just crept upon us.
So could they have a reason from patients, not patients, but border quarantine returnees who may have been discharged because of a negative result, and they may have still had that load of virus to be able to transmit it to others in the community?
Yes, that was actually explored. You remember when we went back to the case in Tanoa, we went back again to 95 discharges, tested them, one was positive. So what you're saying is a possibility. It is a possibility in every single quarantine facility in the world, where you have what we call slippage through the protocol. And it usually happens if there is some degree of bubble mixing that's happening in the time while they are in quarantine. I mean, the quarantine facility had worked a protocol that ensured that people stayed in their rooms. There was no, when they came out for exercise, there was a program for coming out for exercise that was overseen. We held for 365 days on that protocol. Others, as I keep repeating, more resourced than us, have slipped much earlier with bigger spread. Okay, so I think I keep mentioning for quite a while now, the quarantine program is manned by human beings. The frailty of human nature we can never overestimate. It's a reality that we have to live with. So it was because of that in the background we asked everybody to do the COVID-safe measures and to maintain our COVID-safe measures. It was because of that we asked us to maintain the quarantine, the curfew hours, maintain the nightclubs from not opening. It was all because of the fact that we knew there's a high chance that our quarantine could slip. Okay, and so we did not go back to zero. We stayed halfway up, so this is why our response is fairly robust when we got this outbreak.
Thank you very much, Dr. Pong. Thank you, members of the media. That also concludes our press conference for tonight. Now, valuable for coming tonight.
And that was the latest COVID-19 briefing from the Ministry of Health. Now, there's a lot to unpack from tonight's announcements, but I will quickly try and recap and summarize some of the more salient points. We have 4 new cases of COVID-19 as of today. One is a border quarantine case. Another is a 47-year-old nurse from the Raiwanga Health Center and her 52-year-old husband, both of whom tested positive this afternoon. As a result, Raiwanga Health Center has been closed and all staff and patients who are at the facility are in quarantine. The 4th COVID-19 positive patient or person is a 25-year-old nurse at the Lautoka Hospital, and she tested positive while in isolation at the Lautoka Hospital, which has been under lockdown since yesterday. And there is one border quarantine case, a Tongan national who was repatriating back to Tonga, but tested positive while in quarantine. Now, the other point to make is that with the closure of Lautoka Hospital, there will be a field hospital set up in Lautoka, and the Fiji Emergency Medical Assistance Team has been activated. There's a group of doctors and nurses who have been brought over from Lambasa to add support to medical services in Lautoka. The private practitioners in Nandi, Lautoka and Ba, a group of them, have agreed to offer treatment and consultation to patients who cannot access Lautoka Hospital. The list of doctors will be confirmed tomorrow, and the Health Ministry is calling on other general practitioners or private practitioners in Nandi, Lautoka and Ba to get in touch with the ministry and offer their services. All services will be paid for by the government. Any member of the public in Nandi, Lautoka or Ba who visits any of the agreed private practitioners or GPs will have their treatment and consultation covered by the Health Ministry. Also, confirmation tonight that the spread of COVID-19 at the Lautoka Hospital is not as a result of any breaches at the Lautoka Isolation Ward. All staff who are working inside the Lautoka Isolation Ward for COVID-19 all tested negative for COVID-19, and the Health Ministry or Dr. Fong says this is actually more concerning news because it means that the cases that were picked up or the patient who did test positive was a result of a community transmission. Also, the announcement tonight that all medical measures being taken, all the steps being taken at not just Lautoka Hospital, but all other medical facilities, all the screenings and all the COVID-safe measures that are being taken are to protect the Colonial War Memorial Hospital, to protect CWM Hospital in Suva, to ensure that there are no cases detected or there is no exposure to COVID-19 for staff and patients at CWM Hospital, which is the largest hospital in Fiji, offering the widest array of services. Now, as I mentioned earlier, the Rewanga Health Centre has been shut down and services have been diverted to the Samambula Health Centre, Valilevu Health Centre and the Sai Sanjeevani Health Centre for those who used to rely on the Rewanga Health Centre. As of now, Rewanga Health Centre will remain closed. The source of transmission for the nurse from Rewanga, contact tracing is underway, and there is also contact tracing for staff and patients of Rewanga Health Centre to try and see if there are other people who may have been exposed. Now, there was quite a bit announced tonight, but for now we will continue with our bulletin, and you can log on to our Facebook account, or actually you can log on to our FBC News website and access our FBC app, where we, as of now, have updated all the latest information from the Health Ministry's press conference. Every detail is on our website, it's on our app, it's on our Facebook page as well, so you can log on there and get updates on anything that I may have missed out in my recap. For now, we will continue with our bulletin, and up next, we have sports.
The Fiji Rugby Union has less than 2 months to secure private investors and finally seal the Fijian Roos spot in next year's Super Rugby competition. After being granted a provisional license by New Zealand Rugby last month, the Ndrua are starting to attract some interest, including Hawaii-based Kanaloa Pacifica. Kanaloa CEO Tracy Atinga revealing to ABC's Pacific Beat they stand ready to assist the Ndrua. Akuladama has more.
We've actually offered our investor group forward to the draw. And the reason being that it is a standalone entity, much similar to what Kanaloa had proposed. The drawer are looking for private investors to stand up their organisation.
We've never had any discussions with Kanaloa, and the deadline required.
KVT Silktails head coach Wes Naingama has commended his senior players for stepping up and leading the team in the Iran Massey Cup. The Silktails have been in Australia for close to 3 months, and Naingama is pleased his senior players have been paving the way for the young team. Venina Rakautonga has more.
Penioni Tangi Tuimua has been doing a good job leading the pack consistently.
Probably the standouts, probably Penioni, our captain, he's led from the front every week, has been really consistent, getting the boys, through games and that. Also probably, Pio Steady was a standout before he got suspended.
The younger players say they're enjoying the competition.
The competition here is intense, and we are happy that we can learn from other teams, and also the older players help us a lot.
The level of competition in Fiji is not the same as the one here, but we have the coach, senior players that guide us through.
The Silktails are in 6th place with 8 points after having registered 3 wins and 3 losses so far this season. Silktails play Hawks on Saturday at 5 p.m. Venina Rakautonga, FBC Sports.
Chelsea has set up an All-English Champions League final against Manchester City after a commanding 3-1 aggregate win over Real Madrid. The Blues face City in the final in Istanbul, Turkey at the end of the month. In today's Play of the Day, we take you to Major League Rugby in the USA, where some of our former 7 stars are playing, including Osea Kolinisau, Tsasa Vermalu and Apanisa Thakaumbalavu. Also plying his trade there is former Fijian Rua Santa Poasa Wangadimbau, who helped set up this try for New England against San Diego. Sports, but coming up in Weird and Wonderful, the man who ditched a psychology degree to build Legos. Find out more after the break.
Heavy rain and isolated thunderstorms were experienced over most parts of the country today. The west was humid with variable cloudiness. Eastwards from Pacific Harbour to Suva, humid with clouds and sunshine. In the north, mostly cloudy with a few scattered showers. At sea, southeasterly winds 15 to 20 knots, moderate to rough seas, moderate southerly swells. The next low tide is at 9:17 tonight with high tide at 3:40 a.m. Sunrise will be at 6:22. The outlook for tomorrow, cloudy periods with some showers and isolated thunderstorms over the eastern parts and interior of the larger islands, elsewhere fine apart from isolated afternoon showers. The outlook for Saturday, cloudy periods with brief showers over the eastern parts and interior of the larger islands, elsewhere mainly fine. And in Fijian Pulse tonight, we ask, do you know the importance of the Care Fiji app?
I downloaded Care Fiji since last year, so it remains on my phone until today. Just because it's so important that just to make the work easier for our front workers.
I don't know what's it. I don't know. Care Fiji app is it actually track people who has the symptoms of COVID-19.
Yes, Fiji app it's important.
Our main stories, there are 4 new cases of COVID-19, 3 of which are local transmissions. A nurse at the Royoanga Health Centre, a 52-year-old husband and a nurse at the Lautoka Hospital, as well as a 4th case being a border quarantine case. And the other headlines, if you stand too close in Suva City, you will be arrested for not physically distancing as of tomorrow, and there are concerns over frontliners' fatigue. For these stories and others, you can tune in daily to our sister radio station, Gold FM. To our poll question, this week we are asking, do you think some Fijians were lying to get food ration in the Suva-Nosori corridor? You can visit our FBC News website to answer. You can also send us newsworthy pictures and videos. Email fbcnews@fbc.com.fj or share it with us via our various social media accounts. That's your news for this evening. I'll be back again tomorrow. Until then, stay safe. Modemata.